Good afternoon, everyone. I'm Russell Rawlings. I'm CFILC's statewide community organizer and also facilitator of the Do Network. And welcome to our second webinar in this series of disability voting advocacy, changes to voting in November 2020. And I'd also like to welcome my co-presenters, Gabe Taylor, voting right advocate at Disability Rights California, Eric Harris, legislative advocate at Disability Rights California, and Jason Connor, staff attorney at Disability Rights California. Next slide, please. I'd like to start off by saying Happy National Voter Registration Day to everyone. Please, if you have not had the opportunity to do so, check on your registration status. It's a great idea, even if you believe that you are registered. Just go and find your county elections office by Googling your county name and elections office and go in and check on your registration status or help someone that you know register to vote today. Okay, we would like to start off with a poll. And you should see the poll appearing on your screen. The question today is, are you aware that there are multiple ways to vote? Which of the following ways have you used in the past? And in front of you, there are a number of options. The first option is in person with accessible ballot marking device. The second option is in person without accessible ballot marking device. The third option is in person using filled out ballot received by mail. The next option is remote accessible vote by mail. The next option is vote by mail, return ballot sent by U.S. mail. The next option is vote by mail, ballot drop off at a drop box outside a vote center or polling place. Or vote by mail, received assistance from someone else dropping off ballot. And the final option is other or not sure. And feel free to share at the Q&A if you choose this option.
This is Megan. I'm going to go ahead and close the poll now and share the results. So you can see that 60% of folks today that took the poll have voted in person with accessible ballot marking devices. 47% of people have voted in person without the accessible ballot marking device. 20% of people voted in person by using their filled out ballot they received in the mail. 73% of people have voted by vote by mail by returning their ballot using U.S. mail. And then smaller percentages have done other options. So I'm going to go ahead and stop that share and pass it back to Russell.
Thank you, Megan. Next, I'd like to pass it over to Gabe Taylor to begin this portion of the presentation.
Thank you, Russell. So as Russell mentioned, Jason and Eric and I are from an organization called Disability Rights California. So for those of you who may not have heard of our organization, we are the statewide protection and advocacy nonprofit organization. We've been around since 1978, and we provide advocacy services for people with disabilities over a wide range of services. Specifically, the focus that Jason and Eric and I have has to do with voting rights, and we are part of the Voting Rights Practice Group. So we are a small group, but a small group of staff members, but we cover all 58 counties, and we work in close coordination with the county elections officials to ensure that they're doing everything they can to make the voting process more accessible. So our chief goal and sort of our constant theme we strive towards is making sure that all voters with disabilities can fully participate in the electoral process. So, you know, our dream, next slide, please, Megan. Our dream is to give everyone that has a disability the right to a private and independent vote. Now we're getting a lot closer than we have in years past and elections past, but there are still portions of the elections process and the voting process that is still inaccessible for voters with disabilities. So we're working very hard to see what counties can do to improve those areas where things are less accessible for voters with different disabilities. Now I'm going to turn it over to Jason and Eric, and they're going to talk about some of the legislative changes that have been enacted recently to make information and the voting process more accessible and easy to use for voters with disabilities.
So, hi everyone. This is Jason Connor from Disability Rights California. I'll let Eric introduce himself.
Hi everybody, this is Eric Harris. I am a legislative advocate with Disability Rights California.
And so we just want to take a few slides and a few minutes to explain some election changes that are happening due to COVID-19. And specifically, we're going to talk about two new laws that were passed in the last few months by the California State Legislature, AB 860 and SB 423. So that's Assembly Bill 860 and Senate Bill 423. I'll let Eric take it away.
Yes, so in May of June this year, Governor Gavin Newsom issued a couple of executive orders, and they did a couple of different things. First, they required that all California voters receive a vote by mail ballot. Second, it allowed counties to reduce the number and hours of in-person voting options, subject to other requirements, plus many more changes. On June 18th, 2020, Governor Gavin Newsom signed AB 860 into law, which codifies the first executive order. And on August 6th, 2020, Governor Newsom signed SB 423 into law, which codified the second executive order. So let me tell you guys a little bit about what legislative advocacy is. So a legislative advocate is somebody who works on legislation by helping draft and advocate for legislative bills that go through our state legislature. To give you guys a little bit of background, the way bills are potentially formed, bills go through a legislative process. The legislative process in California is not unique to other states. California has branches of government similar to the federal government, where we have a legislative branch, an executive branch, and a judicial branch. Our legislative branch is a representative form of government with members of our state assembly who represent about 500,000. Each member of the state assembly represents about 500,000 people. And so in total, we have 80 members of the California Assembly. We have 40 state senators in California that represent about 1 million people. These state legislators are really important and must be held accountable. They work on legislation and are supposed to represent the people of the state of California. You have every person who lives in California has a state representative, and these people are available in terms of reaching out to their staff. Their phone numbers are all available, and they are public servants. As the slide states, it is important that we hold them accountable and make sure that they are representing us to the levels that we require because they work for us. So let me tell you a little bit about why and how AB 860 and SB 423 matter to people with disabilities. AB 860 is a bill that requires that all registered voters in the state of California receive mail-in ballots. That can be very helpful for a lot of people with disabilities. Many of us who have disabilities might have issues and challenges when it comes to our transportation and getting to polling locations. And so being able to vote from home safely and in a healthy way will give us opportunities to participate in the civic process without compromising our health and our immune systems. As we all know, people with disabilities tend to more, in a disproportionate way, have immune systems that might be more compromised, health issues that might create situations where COVID can become more rampant and more debilitating for a lot of reasons. And so being able to vote from home is one way that we can make that situation better, and being able to vote by mail. So all registered voters will receive a vote by mail ballot 29 days before the November election. So this option promotes the health and safety of Californians who prefer to vote from home. All registered voters will also have the option of using their county's remote accessibility vote by mail system. So before AB 860, only voters with disabilities and certain overseas voters could vote using a RAVBM ballot. Third, voters can return their ballots using prepaid postage, but all ballots must be postmarked on or before Election Day. Ballots postmarked by Election Day must be counted even if received up to 17 days later. I know that that is a major concern, especially this year. We know, we've seen the news, we've heard in the news the issues involving the U.S. Postal Service. So we know that, there are certain people who are concerned that they have to get their ballot in right away. And I want to encourage, I know, those of us who are voting rights advocates want to encourage people who want to participate in the civic process this year to do so as soon as possible. As soon as people get their ballots, to fill them out and do what they can to get them in. Because of course, we hope that everything works the way it's supposed to. We hope that there are not any issues. And those of us who are advocates are advocating to make sure that people's votes are counted. But we want to make sure that people do their part and get these ballots in as soon as possible to make sure that there are as few errors or mistakes in terms of this process as possible. As far as the changes to in-person voting, so California's 15 Voter Choice Act counties can limit vote center days to just 4 days. Second, any county can conduct traditional or consolidated elections with fewer voting locations, but there must be one polling place for every 10,000 registered voters, with accessible voting machines, open at least 3 days pre-ED, with one location open 28 days prior. Counties must also provide ballot drop boxes, one for 15,000 voters, open 28 days prior. Consolidated counties must provide a polling place that are accessible and conveniently located for voters with disabilities. Voters also have a 10-day opportunity to comment on proposed locations. Counties that can't meet SB 423's requirements can apply to the Secretary of State for a waiver after posting a plan and accepting public comment. And so, kind of to tie this part together, we as an advocacy community, as voting rights advocates, as disability advocates, recognize that COVID presents certain challenges for in-person voting. We saw examples in the primaries in Wisconsin and other states where there was a lot of in-person voting, a lot of large crowds, and people contracted COVID-19. And so we didn't want that to happen. We understand that as a state, we want to limit crowds, we want to limit in-person contact. And so we understood as advocates that there was going to be some limitation when it comes to in-person voting. But as disability advocates, we also recognize that a lot of people with disabilities must vote in person. A lot of people with disabilities need to have assistance. A lot of people with disabilities who vote need to be able to use voting machines, and some people with disabilities might not have regular access and easy access to mail. And so in-person voting still matters to a lot of voters with disabilities. The Voting Rights Practice Group at Disability Rights California has advocated all summer, spring and summer really, to make sure that even though we're in a state of COVID, even though we're in a state of emergency and stay-at-home order, we wanted to make sure that as many options were available so that people with disabilities can vote privately, can vote and can make their own decisions about how they choose to vote.
Great. So with that overview of those two laws, you might be wondering, what are counties doing this election? And fortunately or unfortunately, that answer is it depends. We have 58 counties in this state, and every county conducts its elections in slightly different ways. However, it's good to start with the 15 Voters' Choice Act counties, and you can see them over on the left-hand side there. There are 15 Voters' Choice Act counties. And so basically what SB 423 does for Voters' Choice Act counties, who in the past 2 or so years have been conducting their elections primarily through vote by mail, but also with consolidating polling places called vote centers. So they've been conducting their elections that way. So for this election, SB 423 allows them to limit the number of days that their vote centers are open to, as Eric was saying, sort of hinder the spread of COVID-19 and just make sure that everyone is safe during the election. So here are the 15 Voters' Choice Act counties. So most of them have opted into SB 423. So they are getting rid of their 11-day vote centers, and they're only providing 4-day vote centers. And that's subject to only a few exceptions. We know that Sacramento is holding a normal election where they will have early vote centers in addition to the 4-day vote centers. And other counties like Los Angeles and Madera, they're going to have a mix where they do have differing numbers of vote centers. But most other counties, from Amador to Napa to Orange to Tuolumne, they're going to have the 4-day vote centers. A few counties like Calaveras, Nevada, and San Mateo will have 1 to 3 very early vote centers open. That means up to 29 days before the election, so a month before the election. But most of those counties are now limiting their days where they keep vote centers open to just the 4 days. So something we'll be repeating throughout this presentation is making sure that you know your county's details, making sure that you know when the vote centers or the polling places start to open, and that's important, whether you're in a vote center, whether you're in a Voters' Choice Act county or in traditional counties. So what are the other 43 counties doing? This took a bit of wrangling on our part just because it is difficult to keep track of all these counties, so it takes a concerted effort between DRC and our partnering organizations. So whereas the Voters' Choice Act counties, their only change was really limiting those vote center days to 4 days. Non-VCA counties have a bunch of different approaches. So these counties that are listed here, they'll be conducting their elections just normally under traditional polling place election administration. That means that depending on where you live, you'll be assigned to a precinct, and within that precinct, there should be at least one polling place where you can go to vote in person. These 3 very rural, very sparsely populated counties, Alpine, Plumas, and Sierra, are all vote by mail. They have been for quite some time under California's election code. So those counties, I think, maybe except for Alpine, have no in-person options, subject to maybe a few exceptions. So those are vote by mail, and they have been, and they're going to stick with that for 2020. These counties are opting in for SB 423's option for those non-DCA counties to consolidate their polling places. So that means instead of having one polling place for every precinct, which is usually 1,000 voters, they can have one polling place for every 10,000 registered voters, sort of like what the Voters' Choice Act counties do with vote centers. So these counties you see here, they're going to be consolidated. And actually, these counties, you're still going to be assigned based on your address, but you'll have fewer polling places to choose from. These next group of counties also are consolidating, but they're actually not assigned. So like in Voters' Choice Act counties, you can actually go to any polling place in the county, regardless of what your address is, and vote in that polling place. And finally, and this is sort of the theme of this election, there are certain uncertainties and there are still unknowns. We know that at least these three counties, Lassen, San Benito, and Shasta County, are still sort of deciding whether or not they want to consolidate or run their elections traditionally. So that's something to keep in mind. And again, it goes back to our theme of being prepared and contacting your elections office, making sure you know the details that are specific to your county. So let's talk a little bit about your options this November. We've gone over the laws, we've gone over what counties are doing, and that can be a lot, but we want to try to break it down for you just with a few simple recommendations based on your options. So right there, you can see a few, and we'll discuss a few more, but there's a mailbox holding a mailed ballot, so that's vote by mail. There's an accessible ballot marking device, and there's an official ballot drop box. So option one, voting by mail. So all voters are going to receive a vote by mail ballot, as Eric explained, 29 days before the election. So that's on October 5th, counties will begin mailing out voters ballots, their ballots, so they can cast their votes by mail. And that's coming up quick. We know it's September 22nd today, so that's only in about two and a half weeks. So one option within voting by mail is marking, signing, and returning your vote by mail ballot by the mail. So you'll receive your ballot. There should be prepaid postage in there. So you'll follow the instructions within your ballot, mark your choices, sign and seal the ballot, and then you can actually return it by mail. But you can also, instead of mailing it back with the prepaid postage, you can return your finished ballot to a drop box or a polling place or a vote center. So you can actually return those, or you can designate someone else to return them for you to a drop box or a polling place or a vote center. Another important option within voting by mail is remote accessible vote by mail. And Eric talked about how AB 860, the first law we were talking about, expanded remote accessible vote by mail from just voters with disabilities and overseas voters to all registered voters. So not only do voters with disabilities get to use RAVBM as usual, but now all voters can use it. So with remote accessible vote by mail, you can download, mark your ballot digitally using accessible and adaptive technologies, but then you have to return it, print it out, and use an envelope to return it by mail or by Dropbox, or you can drop it off at your polling place. So once you actually print, sign, seal that remote accessible vote by mail ballot, it actually is exactly the same as a regular vote by mail ballot. And that's something we want to take a little bit closer look at, because we know remote accessible vote by mail might be new to some voters. So how to request one? First, you can contact your county's elections office by phone or email, and then they will send you a link online where you can access your remote accessible vote by mail ballot. Or some counties actually have the opportunity to access that ballot through the elections website. So there actually might be a link to a portal on the elections website where you can go and download your ballot. And so the only difference there is you don't have to actually contact your elections office to get your ballot. You can find a link on the county elections website. So let's take about 2 minutes just to look at this video about how to use remote accessible vote by mail.
Voter views computer screen.
There is a new way for people with disabilities to vote at home in California. It is called Remote Accessible Vote by Mail. It offers voters with disabilities the opportunity to vote privately and independently at home.
I'm really excited about Remote Accessible Vote by Mail because in the past, when I voted by mail, I've had to have somebody assist me, and that takes away my right to vote privately and independently.
Traditional vote by mail.
Thank you for helping me vote today, Chris.
No problem. Proposition 12, yes or no, which will increase sales tax?
Yes. But with this system, I can be independent just like everyone else.
Voter uses computer with adaptive technologies.
A voter is able to use their own computer and adaptive technologies to read the ballot
George Washington, independent, checkbox not checked.
and mark
George Washington, independent, checkbox checked.
and review their choices.
George Washington, aye.
The voter then prints their choices and returns them by mail.
Like many individuals with disabilities, I use adaptive technology for many activities. I have a tracking disability. Now with Remote Accessible Vote by Mail, it allows me to read my choices, mark my choices, and review my choices, and print my choices when I'm marking my ballot to vote by mail. But best of all, now I can vote privately and independently, just like everyone else.
Vote checkbox.
Are you having difficulty?
All right, so let me just get back to the PowerPoint. Okay, so in that helpful video, you saw how a voter with a disability can use their adaptive technology to vote by mail. And that's really important because that gives, especially this election with the pandemic and COVID-19, it gives voters with disabilities the opportunity to use their own technologies in the safety of their home to vote privately and independently. So this is an option that's great, and it is open to all voters this election. And again, those two ways to request your ballot are an important step to remember. Just a final point on remote accessible vote by mail. It is not internet voting. So there is some rhetoric around, especially in the news, that remote accessible vote by mail is internet voting and it's subject to vulnerabilities of the internet. But in fact, the only step where you're using the internet in remote accessible vote by mail is to download the ballot. So once you have that ballot downloaded, as you saw in the video, you use your assistive technologies to mark, sign, and print. And then once printed, it becomes a physical vote by mail ballot. Then you then have to return or mail back to the county elections office. So option two. So we know option one is vote by mail, but option two, a lot of people might want to vote in person. So the first thing you want to do if you're leaning towards voting in person is find out if you're in a VCA, a Voters Choice Act county, those 15 counties we talked about earlier, or you're in a traditional county, the counties that are just going to conduct their elections as usual without changes, or are you in a consolidated county? So those are the counties that used to be traditional, but now under SB 423, they are condensing and reducing the number of polling places they traditionally had into one polling place for every 10,000 voters, so fewer polling places. So knowing this information can determine where and when you can vote in person. So if you're in a VCA county, you have to check and you have to make sure that you're in a county where there is early voting earlier than the 4 days that a lot of VCA counties are limiting their vote centers to, because you want to show up in person and be able to cast your vote. So in the spirit of this, you want to always plan ahead and vote early. Even with in person, you want to vote early. So you want to vote on either on an early voting day or on election day, but very early on election day, or as early as you possibly can on election day. This is the best way to avoid crowding in lines, which is already an issue in the disability community, but it's even more of an issue during a pandemic with COVID-19, with social distancing guidelines in place. It's really important that you get there early on election day if you do want to vote on election day. And locations should be accessible and have accessible voting machines available. So in every county that isn't one of those Voters' Choice Act counties, there should be at least one operational, functional, accessible voting machine. And in the VCA, the Voters' Choice Act counties, those 15 counties we talked about earlier, there should be at least 3 accessible voting machines available in those counties. Again, you want to try to wear personal protective equipment, face coverings, gloves, whatever, and other equipment that protects your person from the virus. However, this is only if that is possible. And if it is not possible, you as a voter still have a right to arrive in person at the vote center. And anyone who arrives in person at the vote center must be allowed to vote without undue delay this November. So this is something we've been really trying to drive home in our advocacy to counties, because some counties are a little confused. We've seen some of their administrative guidance coming out saying to their poll workers, if you see someone who can't wear a face mask, and they sort of discuss that at length, but it's actually pretty simple. Even if someone is not wearing a face mask or a face covering, especially if they cannot or they have extreme difficulty in doing that because of a disability, they still must be allowed to vote without undue delay. That is their right. So that's something you need to keep in mind going in to vote centers and polling places on election day. Finally, and this is a similar, very accessible option, just like remote accessible vote by mail, but if you do show up in person, you can look for a curbside voting sign outside every polling place and every vote center we think should have and be providing curbside voting. So what you want to do is you want to call the number you see on the sign to request a curbside vote. And in some counties, there might even be a doorbell where you have to ring the doorbell. But in any case, every county should be offering curbside voting as an option. And that's when the poll workers will safely bring a ballot out to you outside on the curb or wherever you may be, and you can cast a ballot that way. And I'll hand it back over to Gabe to wrap things up.
Yeah, so one of the final options that folks have is to request an emergency medical ballot. Now, it's not something that, an option that a lot of people know much about, but it is something that all counties should be providing any voter that needs it. So emergency medical ballots are typically available for voters who may be hospitalized or unable to leave their home due to a medical issue. Back in both the 2018 election and also the 2016 election, we got a number of phone calls from voters who needed to use this option. So we've been trying to work with counties to provide a better process and an easier process for people to access to be able to make this an option, a workable option for them. So many counties will provide an online link to their emergency medical ballot request form. Also, many of the counties have been in discussions and have coordinated with some of the larger hospitals and medical centers in their county to make sure that these facilities are provided with stacks of these request forms that they can distribute to patients if they need them. So to begin the process, you must first complete and sign and date the request form, and then have some way of returning it to the county elections office. And so once they receive the signed form from the voter, then they are able to provide them with a ballot. Oftentimes, if folks have either a family member or a friend assist in the process, you have a way of also designating somebody to assist with this process and be able to pick up the ballot and then also deliver it back to the county elections office on your behalf. So the process works a little bit differently. Some counties have the forms available online. Some have, like I said, have worked in close coordination with many of the medical centers and hospitals to provide these forms. So the best course of action is just to contact the county elections office directly to see how the process works in your particular county, because like we said, it varies a little bit depending on what county you're in. So what should you do to prepare? A lot of people have, I try and kind of make a plan, a step-by-step plan of all the things to keep in mind when you're figuring out where to go vote, how you should vote, what you should vote for. So first, make sure you confirm your registration status. You can make sure that you're contact your county elections office, or you can also do it through, many of them have a link on their website to be able to verify that your address information is correct and your all of your party affiliation information is correct, just to make sure that there won't be any delay in getting your voting material. The other really great thing is that it also gives, when you are able to enter your registration information, it gives you information on your assigned polling place or your nearest vote center locations. So that's also really helpful. And we can't stress this enough. If you are planning to vote, go early. Go as early as you possibly can. Coordinate if you do any sort of ride share or you take accessible transportation. Make sure you plan way ahead of time to confirm that you will have a ride to and from the vote center or the polling place. So your other options are, making sure if you're doing, you're returning your vote by mail ballot, if you're sending it back, send it out as early as you possibly can. So complete the ballot and get it in the mailbox as soon as you can. And you also, as we have mentioned, you have the option of being able to, once you complete your ballot, you can have somebody drop it off for you on your behalf. You can drop it off at any one of the county's Dropbox locations. You can take it to the county elections office in person. So you have a lot of different options to make sure that it gets there. And if at all possible, in many of the counties, even the ones that aren't Voters' Choice Act counties, there are counties that are providing extra days to vote. So make sure if you do have that option, get there as early as you possibly can. And the hours and the locations should be available on your county elections website. They usually have a link that gives all of that helpful information. So next slide. So one of the things that we provide voters particularly with disabilities, we provide it as a free service to anyone who has questions at any time. We provide our voting hotline. We specifically sort of advertise it and announce it during election season, but a lot of times we'll get calls even on off season regarding voter registration questions, or if they need to get some information on how you change your voter registration status. So we're available. The number here is listed. It's 888-569-7955. We also provide assistance if you had a situation where you feel that you have been discriminated against because of your disability. We assist voters who've had problems or issues like that come up. We have contacts and connections with all 58 counties. So we work with them to troubleshoot any issues that come up or problems that voters have on or before Election Day. So please feel free to give us a call if you have any issues, or even if you have basic questions. Like, I mean, we've fielded questions like, I can't remember where my polling place is. Could you look that information up for me? We'd be more than happy to help out. So please feel free to give us a call.
So thank you everyone who've tuned in. This is just some contact information for you. Please feel free to call me or email me, my colleagues Eric and Gabe, and always stay in touch with Russell over at Do Network and CFILC. We just want to thank you again for tuning in, and I'll let Russell take it away with the exit polls and Q&A.
Thank you again to our presenters. We would like to conclude this webinar with a short poll. The question today is, how are you planning to vote in November 2020? Understanding that you just received a lot of information, but if you feel that you know how you're planning to vote, feel free to let us know. And if you're not yet sure, feel free to ask a question in the Q&A section that's coming up, and we can have a short discussion. We will be having a third webinar. Our final one will be discussing directly how to put together a plan to vote and to execute it. So thank you again to our presenters. Please follow us on disabilityorganizing.net. Sign up for our mailing list, and follow us on Facebook as well at facebook.com/do network ORG. That's Do Network org. And keep an eye out for future trainings as well. The question is, how are you planning to vote in November 2020? Choose one. In person with accessible ballot marking device. Next option is in person without accessible ballot marking device. The next option is in person using filled out ballot received by mail. The next option is remote accessible vote by mail. The next option is vote by mail, return ballot sent in by U.S. mail. The next option is vote by mail, ballot drop off at a drop box outside a vote center or polling place. The next option is vote by mail, received assistance from someone else dropping off ballot. And the final option is other or not sure. And feel free to share in Q&A.
This is Megan. I'm going to go ahead and end the poll and share the results. And it looks like a lot of people do have a plan to vote. So it shows here that 7 people are planning to vote by mail and return that ballot using U.S. mail. 7 people on the call are planning to vote by mail and drop off their ballot at their vote center or polling place. And then 2 people are planning to do remote accessible vote by mail, and 2 people are planning to vote in person using an accessible ballot marking device. So everyone, thank you for taking that poll. And we do have a few questions in the Q&A. Please feel free to send more questions if you have them. Our first one here is from Jessica, and she wants to know, can you say more about how people get emergency medical ballots, especially for people who aren't comfortable going online? Are these also used for people who are in care facilities?
Thank you for that question. I'll allow my colleagues at DRC to take that initial question. I have some kind of probably additional thoughts, but the question of what the process, a little bit more about the process, and also the important question, does this also apply to people that are in care facilities?
Sure. So regarding other ways to get the process started, so you can contact, if you have access to call the county elections office over the phone, they can walk you through. Oftentimes, if someone contacts them directly, they have typically a public or a published list of the medical centers and hospitals that they have coordinated with. And in many cases, they have a particular staff person at the hospital that they typically work with to ensure the ballot request form process is done properly. So you can contact the county directly. Oftentimes, too, the hospitals may have that information. They may know what staff member is responsible for assisting with that process. So I would just recommend that you can call the county elections office directly.
And I just want to just really quickly, because these are links and they're very helpful. So if you're unsure about your county's contact information, you don't know sort of where to find that. Obviously, you can go on Google and Google, Alameda County elections, and the website, the elections website in that county should be the first link to pop up. And you can fish around for the contact information there, or this link, which is pretty helpful. And let me just share this really quick. So you should be seeing a county elections office page from the Secretary of State. So the Secretary of State in the, so you go to the Secretary of State, the main page, you can go to elections and voter information, and then voting resources. And then in the voting resources page, you can click county elections offices. And if you scroll down, you can actually see listed all 58 counties. You can see here's Amador County. You can see the registrar of voters. There's the physical address. There's the telephone number, and then the email address. And it even gives you the hours of operation. So we think this is a great resource. If you really quickly just need to find your county's contact information, this is a great resource to go to. And these links, which are in the PowerPoint, should be provided to you after this webinar. So we just wanted to share that's a really easy way to find out what your county elections office contact information is, because at the end of the day, they are your best source in knowing how to vote in November, whether it's in person or an emergency medical ballot. So I just wanted to point that out really quick.
Yeah. Jason, if I just wanted to add to, I had touched on the fact that counties, depending on what county it is, the process varies a little bit. But some of the larger counties have worked very closely few election cycles to ensure that they provide the request forms to the hospitals and medical centers ahead of any given election. I know able to have enough staff or a designated staff person to deliver the ballot request forms, and then to be able to deliver back a ballot to a patient in a hospital. So it's really, really important to contact them as soon as you can if you need to access this option, just so you make sure that you have as much lead time to be able to get your ballot to you and complete it and then get it returned. So.
Thanks, Jason and Gabe. I think there was one piece of the question that maybe wasn't yet answered, and that is, does this process apply to care facilities such as skilled nursing facilities?
It does in some counties. I know that some counties have been in contact with long-term care facilities, but even if the request forms themselves aren't available at the facilities, the process is still the same. So you can still contact the county, explain to them that you're interested in having this option, and seeing what you need to do to ensure that you get your ballot.
Thanks. I think that this year in particular, given the situation for a lot of folks, there's going to be a lot more remote accessible vote by mail use and just general needing to access vote by mail. So I think that, like Gabe and Jason have suggested, your first step, if you believe that getting and accessing your vote by mail ballot is going to be difficult for you, is to make sure that you make that early contact to your county elections office. And they're very personable there. They can answer by phone. You can even ask them questions right now. You don't have to wait until you receive your mail ballot. You can contact them now and ask, just so that they know that they're going to have, be aware that they can work with you.
Thank you, everyone. This is Megan again. We do have another question here from Jacob. He wants to know, how can I verify that my ballot was received and that my vote was counted?
Thanks, Jacob. So the Secretary of State under California election law has to maintain a ballot tracking service. So there is actually a website you can go to. It is in the Secretary of State's website. It's sort of a web page within that website, and it's called Where's My Ballot? And so that helps you track, specifically that helps you track your vote by mail ballot when it is mailed, received, and counted. So that's something you can actually sign up for online, and you'll receive automatic emails, texts, or even voice call notifications about your ballot. And that should be available in every county.
Thank you. And if folks have more questions, please feel free to send them to us in the Q&A. Somebody had another question about the Voters' Choice Act counties. Could you reshare that screen and cover the counties that are in the Voters' Choice Act?
Definitely.
Thank you.
Give me 1 sec. And everyone can see my screen clearly?
Yes, your PowerPoint's still up.
Okay, great. Okay, there we go. So again, so there are 15 Voters' Choice Act counties. There were 5 so the Voters' Choice Act, that's an act that it's sort of an opt-in voluntary act where counties can basically choose to conduct vote by mail elections where they send every voter a vote by mail ballot, just like all the counties are doing this election because of COVID. But in addition to that, and because they do that, they can actually limit the number of voting locations they have to just a few vote centers, which instead of the address-based polling places are just based on the number of registered voters in the county. And they can be placed anywhere that's convenient for voters, and then voters can go to any vote center in that county. So the 15 counties, just to list them really quickly, are Amador County. They're doing only 4-day vote centers this November. Butte County, they're only doing 4-day vote centers. Calaveras County, they're also only doing 4-day vote centers. And again, when I say 4-day, that means, just to be a little more specific, that means these vote centers they're open from 7 a.m. to 8 p.m. at a minimum, starting on October 31st, the Saturday before the Tuesday election day. So they'll be up October 31st, that Saturday, November 1st, the Sunday, November 2nd, the Monday, and election day, November 3rd. So again, that's Amador, Butte, and Calaveras, all doing 4-day. I know Calaveras has at least one location that's going to be open for an entire month before the election day, so 29 days before election day. El Dorado County is also a Voters' Choice County, and they're doing 4-day only vote centers. Fresno County is a Voters' Choice Act county, and they're also doing 4-day vote centers. Los Angeles County is a special case under the Voters' Choice Act, but just to keep it simple, they're also within this group of counties, and they're doing sort of a mixed bag because it's such a massive county with millions of voters. So they're doing a mixed bag of 4-day vote centers, but also vote centers that open a little bit earlier than 4 days. And I think they have up to 75 this election, so they'll have options for early voting. Madera County is also doing a mix like Los Angeles. Mariposa County is doing 4-day vote centers only. Napa County is doing 4-day vote centers only. Nevada County is doing 4-day vote centers only. But they'll also have that month before election day vote center option open. Orange County is doing 5-day vote center days. Sacramento, like I mentioned earlier, is just conducting a normal Voters' Choice Act county sort of election with 11-day and 4-day vote centers. San Mateo County is doing 4-day vote centers, although I know they have 3 very early vote centers open a month before the election. And finally, the last 2 vote centers, Voters' Choice Act counties, are Santa Clara, which is only doing 4-day vote centers, and Tuolumne, which is also only doing 4-day vote centers. So I hope that answers your question. Sorry, again, that's a lot of information, but those are the 15 Voters' Choice Act counties. And this is a slide that hopefully you'll be able to review. I know Megan can confirm this, but I'm pretty sure we're sending this out to attendees after this PowerPoint out to attendees after the presentation. So that's something you can check back with. But those are the 15 vote centers. Thanks for your question.
Great, thank you, Jason. And we do intend to include this PowerPoint with the archive. So we are about at time now. Thank you everyone for joining us for our webinar today. We will have the recorded archive up online on Disability Organizing's website in about a week. And a big thanks again to our presenters from Disability Rights California, Jason, Gabe, and Eric, for Russell from CFILC, and also to our captioner for providing access today. When you close out the webinar, there will be a SurveyMonkey that opens up in your browser. Please go ahead and take that and give us some quick feedback about the webinar you watched today. Thank you for joining. Stay safe and have a great rest of your day.